Omega-3 fatty acids, particularly the long-chain types found in marine sources such as EPA, eicosapentaenoic acid, and DHA, docosahexaenoic acid, have long been recognized for their profound benefits on cardiovascular, neurological, and metabolic health. Over the past 2 decades, scientific interest has expanded into their potential role in aging and cellular integrity, especially concerning telomere dynamics. While recent findings are somewhat mixed, earlier and more focused studies present a compelling case that omega-3s may help protect against telomere shortening by reducing inflammation and oxidative stress, two of the most significant accelerators of cellular aging. Telomeres, the DNA protein complexes that cap the ends of chromosomes, act as a biological clock within each cell, gradually shortening with every division. As they diminish, the risk of cellular senescence and apoptosis increases, contributing to tissue dysfunction and age-related decline. Because telomeres are highly sensitive to oxidative damage and inflammatory signaling, nutrients that counter these processes are of particular interest in longevity research. Omega-3 fatty acids, as natural anti-inflammatory and antioxidant modulating agents, have shown promise in this regard. Several early human trials and observational studies reported a strong link between higher blood levels of omega-3s and longer telomere length. For example, a landmark study in 2010 from the University of California, San Francisco followed heart disease patients over 5 years and found that individuals with the highest omega-3 plasma levels had significantly slower rates of telomere shortening compared to those with the lowest levels. The researchers proposed that this was due to omega-3's ability to reduce systemic inflammation and oxidative stress, both of which directly damage telomeric DNA and accelerate cellular aging. Omega-3s modulate inflammation through several well-documented pathways. They serve as precursors to specialized pro-resolving mediators, SPMs, like resolvins and protectins, which help shut down inflammatory responses once they are no longer needed. At the same time, omega-3s compete with arachidonic acid in cell membranes, thereby reducing the production of pro-inflammatory eicosanoids. This anti-inflammatory environment can spare telomeres from constant immune-related oxidative assaults, especially in people with chronic low-grade inflammation due to obesity, metabolic syndrome, or autoimmune conditions. In terms of oxidative stress, omega-3s may enhance the expression of antioxidant enzymes and reduce mitochondrial RLS production. This protective effect is critical because telomeres, rich in guanine nucleotides, are particularly vulnerable to oxidative injury. The indirect antioxidant actions of omega-3s create a more stable cellular environment, reducing the need for DNA repair processes that can sometimes accelerate telomere loss if overactivated or impaired. However, more recent studies have yielded less conclusive results, and this discrepancy appears to depend heavily on dosage, study duration, and population health status. Trials with low dosages, short follow-up periods, or participants with already adequate omega-3 status tend to show minimal changes in telomere length. This suggests that the protective effects of omega-3s may be more pronounced in those with deficiencies, higher inflammation levels, or longer-term supplementation. For example, a 2012 randomized controlled trial that lasted only 4 months showed a slight but favorable change in telomere-associated markers, but a longer or more intensive intervention might have revealed greater effects. Another critical factor is the form and quality of omega-3s used. Marine-based sources like fatty fish, krill oil, or purified fish oil supplements rich in EPA and DHA appear to be far more effective than plant-based ALA, alpha-linolenic acid, which the body converts inefficiently. Bioavailability and consistent intake are also crucial. Sporadic or low-dose use may not deliver the sustained biochemical environment needed to protect telomeres. Despite mixed findings, the broader health benefits of omega-3s remain clear, and their potential role in slowing telomere shortening is supported by plausible biological mechanisms. Even in cases where telomere length is not significantly altered, omega-3s still improve many upstream variables: reduced CRP levels, lower IL-6, improved lipid profiles, better insulin sensitivity, that are known to impact cellular aging and genomic stability over time. What's encouraging is that omega-3 supplementation is safe, well-tolerated, and widely accessible. It also synergizes well with other telomere-preserving lifestyle interventions such as regular exercise, stress management, and a whole food diet. When integrated into a broader strategy of anti-inflammatory living, omega-3s may contribute significantly to cellular preservation, even if the telomere-related benefits are modest on their own. In conclusion, while more long-term and targeted research is needed to fully elucidate the connection between omega-3s and telomere length, the overall picture remains hopeful. These essential fatty acids represent a low-risk, multi-benefit strategy for promoting cellular resilience. In the context of aging, they offer a biologically plausible and potentially powerful tool to support not only longevity, but also the quality and integrity of life at the deepest molecular level.